Alcohol use. I'm Dr. Nadeem Sajjad Raja. Drinking alcohol is a health risk, regardless of the amount. While the risk is low for moderate intake, the risk goes up as the amount you drink goes up. The bottom line is that alcohol is potentially addictive, can cause intoxication, and contributes to health problems and preventable deaths. If you already drink at low levels and continue to drink, risks for these issues appear to be low, but the risk is not zero. The harmful use of alcohol is a causal factor in more than 2,000 diseases and injury conditions worldwide. 3 million deaths every year result from harmful use of alcohol. This represents 5.3% of all deaths. Overall, 5.1% of the global burden of disease and injury is attributable to alcohol, as measured in disability-adjusted life years. Beyond health consequences, the harmful use of alcohol brings significant social and economic losses to individuals and society at large. Alcohol consumption causes death and disability relatively early in life. In people aged 20 to 39 years, approximately 13.5% of total deaths are attributable to alcohol. There is a causal relationship between harmful use of alcohol and range of mental and behavioral disorders, other non-communicable conditions, and injuries. There are some people who should not drink any alcohol, including those who are younger than age 21, pregnant or may be pregnant, driving, planning to drive, or participating other activities requiring skill, coordination, and alertness. Taking certain prescriptions or over-the-counter medications that can interact with alcohol. Suffering from certain medical conditions, recovering from alcoholism, or are unable to control the amount they drink. Then, thank you very much for watching this video. If you have any questions, please write down in the comment section. I'm Dr. Nadeem Sajjad Raja.